Good morning, ReMar nurses. I'm here. I made it. I am in the Philippines. It is an amazing Tuesday. It's an amazing Tuesday right now. And I just want to thank everybody for your prayers, for safe traveling. Me and my family, we arrived here. And it's been just beautiful, just absolutely beautiful since we got here. So this is Monday Motivation. I'm in a conference room. It's really nice. I'm staring at the Sheraton here in Manila. So my first destination. So it's good to be here with you all. No sound. Can you guys hear me? No sound? No sound? No way. Let's see. Let me see audio. Testing 1, 2, 3, 4. You guys can hear me? All right. I think I'm good. Okay. All right. So we're going to talk about amputation today. And amputation, of course, comes from quick facts. Now, the thing that I want to review is how we should be clinically reasoning amputation. And one of the things about clinical reasoning is that, of course, you can't do it without the facts. So we start with quick facts. And then, so today we'll talk about the implications of an amputation, because I know you probably read it, and I'll be sharing my notes with you. This is on page of quick facts page. Help me. Okay, yes, page 6. So amputation actually is very much an acute condition. Okay, it's a very much acute condition. So we're gonna dive into it. Okay. All right. So hey, everyone that's here, I'm so happy to be in your presence on today. Just as a note, the Travel Nurse Bootcamp, these things are happening on Wednesdays. So make sure that you are tapping into Wednesdays being just prepping for travel nurse, and the webinars that we do to prepare you to actually do what I just did, which is get on a plane and go somewhere new, right? And this is all about professional development. When we talk about traveling, this is an opportunity for you to grow by working in a new facility, learning new technology, taking care of patients in a new demographic location. How was your flight to Manila? It was amazing. 17 hours on Philippine Airlines. Cannot recommend them enough for international flights. Typically I fly Delta, but the Philippine Airlines better than Delta for this leg. So the journey. So really good. 17 hours. It actually felt like maybe 5 or 6. And my kids did really good. Even the baby did really well. So I am really happy to be here. Okay. As I stated previously, I am here in the Philippines. I have come thousands of miles to help you pass your NCLEX, the nurses who will be meeting me in my locations. My class is coming up in just a few days. My first class is coming up. So if you are attending any of these classes, I hope that by now you have signed up at remarnurse.com/PH. And yes, I will be selling these books. So most people who are coming because they know the books will be here and they can get them here on the island. So you're going to be purchasing your books. This book, I brought the workbook. This book, we have some first shifts. That's all. So, but these will be the 2 major items that you'll be purchasing along with the V2 platform. So we've come all the way here so that you don't have to fly until you get ready to go to the US. And so I'm looking forward to that. So again, the classes are going to be coming up, Baguio, Manila, Cebu, CDO, and Davao. All right. And this is the first time I'm literally making history, because this is the first time an NCLEX tour has ever been done here. All right. So we're counting down the days. Baguio, April 4th is happening. Yes. All right. So we're going to get into amputation. We're going to get into, it's a free masterclass. I'm bringing new information. I'm really kind of excited about it because I'll be talking about things I've never talked about before, just things that I'm learning about NCLEX. And I just really want to give the nurses the advantage when they go take the exam. So it is a masterclass as well. All right. And it's free. So we're talking about amputation. I promise I won't keep you long today. Okay. Amputation, when we discuss amputation from the perspective of quick facts, we know, I can put up my first slide. Let me get to it here. We know the amputation. Quickly, we're going to be talking about amputation being this, right? It's the removal of a body part. Everybody knows that. Either it's a tragic amputation or it's a surgical amputation. For us as nurses, we want to work with the more surgical amputations, right? Those are the ones that are planned for. So are we all on the same page? Are you guys all ready? Put ready in the comments if you're ready with me, if you're up with me. I stayed up really late to do this live class with you. So I hope that my people are here studying with me, okay? And I feel all my international nurses, you know what? When I landed in that airport, I became the international nurse. And so I feel y'all now. I feel what it's like to be up at midnight studying. Oh man. Okay. It's just such a, it's just a real experience when you're an international nurse and you come into a new country and you have to learn the culture and you have to learn, the food and the way things are organized. And I'm asking for things and they're like, no, we don't have that here, and it's just like, whew, all right, let's do this. We just gonna dive in. Okay. All right. So when we talk about amputation, we are talking about a body part being removed. Now, my first critical thinking question, because you showed up to this class for critical thinking, right? What is the reason why a patient would get an amputation? What's the reason why? We're talking about surgical amputation. When the surgeon goes in there, what is their main goal for the amputation? What is it? What are we talking about? Yes, I see it. Absolutely. Absolutely. The main reason why a patient gets an amputation is to get rid of dead tissue. That's it. Main reason why is to get rid of dead tissue. That is why. Okay, that's why. All right. So it's gangrene tissue. Can't be saved. Has to go. Right. Name 2 conditions that would be the cause of an amputation. And you can just give me 2. There's 2 main ones when a surgeon does an amputation, typically, and think more like chronic conditions, because of course, if somebody was in a motor vehicle accident and they lost a limb and it was partially severed, but I'm thinking of just like chronic conditions, lifestyle conditions that would cause an amputation. And this is also important as we are preparing to get into NCLEX questioning, okay? Because NCLEX is probably not going to question you about an amputation based off of a motor vehicle accident, okay? 2 main causes. I see some other good ones there. Smoking, diabetes. Yep. Smoking, diabetes. Why do I say smoking? Because when we talk about our disease processes in class, whether we're talking about peripheral vascular disease, right? Whether we're talking about, what did we just talk about the other day? Circulatory problems with Raynaud's versus Burgers, right? Smoking is going to affect the circulation of the large vessels in your body. And that's why it's the cause of so many problems, because that's what smoking does. It is going to deteriorate those large vessels in the body. Now, diabetes, diabetes, it's going to deteriorate the small vessels in the body. And so that's why you get the neuropathy and you get the decreased circulation. Okay, I won't belabor that, but you guys have there was some other ones I saw, like cancer. That's a good one too. But the main ones are going to be smoking, diabetes, right? And so what are the effects of an amputation? Just generally, we know that patients who have limbs amputated are going to have their balance affected. And I'm focusing more on the lower limbs because honestly, the upper limbs are typically able to be saved, right? When we talk about like amputation of limbs, it's the legs that go, right? It's the legs that usually end up getting cut. So balance, gait, pain, and it being just incapacitating. So patients not being able to rehab after this amputation, which leads to lifelong immobility, right? And then psychological is social stigmas, feelings of incompleteness. Now, one of the things that I want to make sure that we understand is that there is something that I wrote here in Quick Facts on page 6. It says, a complication of an amputation performed is phantom limb pain. Now, is phantom limb pain real pain? Yes or no? Right? Somebody answer that question. I said when I was reading this study, and I was like, oh, I wonder if I asked them, what would they say? Is phantom limb pain real pain? I see some people saying no. I see some people saying yes, right? And so this is one of the reasons why we go over this stuff, because we don't want to take anything for granted. Phantom limb pain, real pain. Yes, real pain. Patient is experiencing real pain. Now, the fake part of it, and this is where we have to be careful, the fake part of it is that the limb is no longer there. That's the phantom part of it. But the actual pain is real. Okay, don't miss that, because that is an NCLEX point, right? I like that. Pain is subjective. So we want to be mindful that we are expecting patients to report pain. We're expecting that, right? So the limb is gone, but the pain is real. You say your mom has it all the time. Oh, so how could it be pain? How could it be pain if the limb is not there? Ooh, good question. What we're talking about though, and what it is that your patient has had their nerves severed, right? Your patient has had vessels cut off. So at the stopping point of that surgery, that pain is there. That pain is still there. And the patient and the brain is saying, oh, I have pain here because this is where my leg used to be, right? Or they have pain distal to the surgical site, but the pain is it's like, yeah. Yeah, so the pain is about the destruction of that nerve. So that's a real pain. Okay. Good question. All right, complications, and we're gonna get into it, okay, a little bit more. Complications of the amputation, just make sure you're aware of it. Hemorrhage, infection, phantom limb pain, flexure contractures, okay, whether it's the hip or you can also have contractures of the knee, okay, and then the psychological maladjustment. All right, read my notes here, okay. All right, so you have the positioning, and this is what I want to go over, the positioning of the above the knee amputation and the below the knee amputation. Okay, above the knee amputation, below the knee amputation. All right, so when we are discussing that, I have focused in on quick facts. The positioning. But what we need to talk about is not just the positioning, but actually the benefit of both, right? Who would be more appropriate for one as opposed to the other? So I want you to just take a minute and let's read my notes here. So it says above the knee amputation. Here, this is when you're doing this, you want to prevent an internal or external rotation of the limb, right? So you can use a sandbag or you can use a rolled towel. But after you have this procedure, you want to make sure that the leg the leg is positioned in the right way. Below the knee amputation is very important for during the first 24 hours, you support that stump with pillows, okay? But not elevated to prevent flexion, contraction, and edema. Also, NCLEX will say wrapping the residual limb in a figure 8 position is effective in reducing swelling, in reducing, in reducing edema, and also shaping for a prosthesis. Okay, so make sure you have these things written down. All right. Are you with me? Are you with me? Are you with me? Okay, so here's my first question, and this is a critical thinking question here. This is a critical thinking question. All right, we're talking about a AKA and a BKA. What will a BKA patient have that an AKA patient will not have? Okay. What will a BKA patient have that you have to care for that an AKA patient will not have? Anybody know? All right. And I did see the comment. Somebody was talking about phantom limb pain. Do you give pain medication for phantom limb pain? Absolutely. You would give pain medication for phantom limb pain. There's many things that people can do for phantom limb pain. They can give like a pain that reduces the neuropathy, like gabapentin. Some people will put a TENS machine on it. Some people will put a massage, Yes, it's a common question. So what will a BKA patient have that an AKA patient will not have? And this is simply a knee. It's a knee. Okay. So above the knee amputation, there will be no knee. So you do not have to worry about the knee, the severed circulation, and all the things that go in line with that. This is a very important point. And I know it may seem like, okay, but if you miss it, it will not allow you to clinically reason moving forward. Okay. So we're just starting at the foundation. A knee joint is very complex, right? A knee joint has to be taken care of, has to be considered. All right, I'm gonna move forward. So infection, right? Infection, healing. Think about that. An AKA versus a BKA. If you have the BKA and you have the knee, or you have an AKA and you don't have a knee, which one is more prone to infection? Okay, so preventing infection in general, we're going to administer antibiotics before, okay? It's called prophylactic antibiotics. This is before. Initial pressure drainage is removed by a surgeon only. We know that as nurses, we never do the first dressing. Never, right? Aseptic wound care regularly, and we're documenting the drainage, okay? Also, if you're talking about non-pharmacological pain management, remember phantom limb pain is real pain. So you can do, let me make it big so you guys can see it. Body directed, which is a physical, so reducing pain triggers, promoting comfort, massaging, applying heat or ice, electrical stimulation. All right, mind directed can do relaxation, self-hypnosis, pain diary, journal writing. These are just, things that we can support our patient with, because this is big. Spirit directed, prayer, self-reflection, rituals, and social interaction is, community, pet therapy, restoring that functional joint or functional limb. Okay. What is the difference between a BKA and an AKA? Okay. So just It's just kind of what it is. Like the BKA is a below the knee amputation, and an AKA is where the top of the knee joint would start. That and all the way down would be removed. Okay, that and all the way down. And there's plenty of, there's plenty of surgeries like this. You can even watch them on YouTube. They're there for you. All right, let's get into some NCLEX questions. I kind of want us to apply this information to NCLEX questions. So let's try to do it. Let's try to do it now. First question is this. In caring for clients with a new amputated part, which of the following findings is the priority? Number 1, depression. 2, immobility. 3, infection. Or 4, disturbed body image. What would you say if you had this in front of you on NCLEX and you are ready for it? It's your test day. You've been studying. You've been coming to class. You got the facts. Because like I said, when you have the facts and you have definitions and you have understanding and then you can apply it in clinical reason. So as the nurse, your priority is going to be number 3, infection. I don't know why I put up 2 fingers at first. It's 3. 3, infection. Infection is a common complication, and it is honestly the one that you are there to be able to assess, recognize, treat it, okay, with the doctor's order. Okay, question number 2. Let me read this one. It might be a little difficult to read. Let me see. A client who has undergone above the knee amputation for almost 3 months now and is still reporting pain in the residual limb. What is the best response of the nurse? Okay. Number 1, reassure client that it is normal. 2, assess for other causes of pain. 3, advise client to continue pain medication as needed. 4, encourage client to massage the stump. Remember, NCLEX is about what? This is a great question. This is a great question. Nadine, hi Regina, I'm a ReMar nurse. Thanks to you. Thank you for giving me the opportunity. I'm so glad to hear that good news. Correct answer is number 2, assess for other cause of pain. Stump pain is normal and it's usually felt over a period of 1 to 3 weeks of time. So when a patient is 3 months reporting pain as just part of your nursing process, what do you do? Like, what do you just do for NCLEX? You want to assess for other causes of pain. You do not want to dismiss your patient at all. This is a safety question, all right? And your patient has had an above the knee amputation. So we want to make sure nothing else is going on with this patient. Very good. Okay, how about this one? This is critical thinking. It's just 2 options here. Which amputation will cause more phantom limb pain, and above the knee or a below the knee amputation? We said phantom limb pain is real. Phantom limb pain is expected. Which one would cause more? This is critical thinking. Okay. All right. Phantom limb pain. Correct answer is going to be number 1, an above the knee amputation. Why did I say that? Why is it that? Not even did I just say that. Why is that? It's just the truth. An above the knee amputation. And it is simply because with an above the knee amputation, you have more of the limb cut off, right? You have more of the limb cut off. You're into the large vessels of the thigh, right? So the knee is gone. The leg, right? The foot, the toes, everything is gone. So you have a greater sensation of phantom limb pain because the majority of your leg is gone. All right. So that's how I want you to think about that. That's why that's the right answer. All right. And I can keep going, right? Remember, you're here to learn. You're here to learn, right? Okay. Let me see the next one. How did I do it? Oh, here we go. Which amputation is better for an active adult with peripheral artery disease, but still walking with assistance? Is it number 1 and above the knee or 2 below the knee? If you have an active adult with peripheral artery disease, but still walking with assistance, above the knee or below the knee, which one you gonna do? Which one you gonna recommend? Okay, and see, we take in a general topic like amputation and we can make it as challenging or as easy as we want it to be. Okay, and it's just applying critical thinking. Correct answer, below the knee. Because remember, with below the knee, these are the types of patients who typically are going to be fitted for prosthetic devices, right? Somebody that's able to, did I do that right? Did I say it's 2? I'm sorry, it's 2 below the knee. I don't know. It shouldn't be 1. It should be 2 below the knee. All right. So if you pick below the knee, that was right. Okay. And again, below the knee, this person here they're still walking. So with the below the knee, you can get fitted for a prosthetic device. And the patient is at a better chance of having a healthy rehab because they're active. They're active. Okay. Here we go. Which amputation is better for a bed-bound elderly patient? Okay. Which amputation is better for a bed-bound elderly patient? Number 1, above the knee, or 2, below the knee? Which one? Bed-bound elderly patient, what we're going to do. And this may spark some of my surgical nurses, some of you who will be in surgery, who want to do OR. You will have this knowledge. You will have these patients with you. And it is so good that you have this understanding. Really, all nurses should have it. Correct answer is going to be number 1, above the knee. Yes. And the reason is because, remember, when the knee is present and the patient has had an amputation, there is a risk for contractures. So that's a big one. When you have the knee, you don't want that knee to develop a contracture. So one of the things that you would get up and do is you get up and walk and you would move around, right? So that knee doesn't get contracted. But if you have an elderly person who is bedbound, get that knee off of there because it's just going to put the patient at risk. One thing that you will hear surgeons say all the time is that above the knee amputations always heal. They always heal. Below the knee amputations don't always heal. They don't always heal well. Why do you think that is? Why is an above the knee amputation always going to heal? But a below the knee amputation, why would that be less likely to heal? I don't know if I said it. Did I explain that right? What do you think? What is it about a below the knee amputation? What are you closer to with a below the knee amputation? It is because and I'm reading the comments, the below the knee amputation typically is closer to the gangrene, closer to the tissue that is dying, right? Because normally the knee joint is not the necrosis area. It's the vessels below the knee joint. So if you cut right at the knee joint, like if you do a below the knee amputation, those vessels there are closer to the dead skin, the dead tissue, right? So even if you cut it, sometimes that necrosis still remains. And that tissue does not heal well, right? And that the circulation is not great because you have the knee. I'm touching my knee as I do it, right? You have the knee, you have the vessels, and so they don't do well all the time. But if you cut it off above the knee, get rid of the knee, all that dead tissue, it will heal, right? And so those are the things that you will be considering when you're taking NCLEX and you're having discussions about above the knee amputation, below the knee amputation. That's the proficiency that you must have, okay? But it starts with just knowing the facts, and we can dive into it as deep as we need to. So that's why I love these classes. I said, I got to do this class. I wanted to make sure I do it. Hey, Thank you guys. This is part of the understanding of being a great nurse that can go anywhere, that can work in any hospital, that can be confident. It is literally because of your knowledge, and this is what you're getting paid for. This is what you're getting paid for when you step into a hospital. And so one of the things that I'm doing as I'm talking about my classes in the Philippines is I just want to encourage you guys to know your value. And sometimes your value changes depending on where you are. How many people know that? How many people know that your value changes depending on where you are? And I love this example. I hear it all the time. When you are in the dollar store, right? And you go and you pick up a soda, that soda can be $1. But when you are in a football stadium and you go to get a soda, come on, somebody. Have you ever been to a professional, an NBA game, an NFL game, and you go buy a soda at the concession stand, that same soda will be $6, $7. And you will pay for it because of where you are. It's the same with nursing. You can be a nurse in the Philippines and be making however many pesos you're making, okay? But when you take that same nurse and you transplant that nurse in the United States, come on, $80 an hour, $90 an hour. I take a nurse in Kenya or a nurse in Nigeria working 3 times as hard as anybody else, making however many in your country's money. But when you come to the United States and you get paid in dollars, the value is different. Now, we in the United States, us who are born here, we look at it by like state to state, like, oh, nurses in California make more than nurses in Florida, but things like that. But I'm talking about life-changing 3 times, right? The nurses in the United States make 3 times the nurses in the Philippines. The nurses in the United States makes 3 times per hour the nurses in Kenya. So professional development is about allowing this nursing license to work for you, not the other way around, okay? You are doing all of this so that you can have a certain life, right? I am doing all of this so that you could have a certain life. And it's pretty much the same life that I have, right? I want you to see that it is possible to accomplish all of your dreams, okay? But you gotta listen. You have to listen to the way it's done, okay? You have to listen to the way it's done and be willing to follow those steps. I have here, when I first got here, and I'll just tell you this before I go into my Monday motivation. When I first got here, one of the first things I saw was a Filipino man wearing a Make America Great Again hat, right? He was wearing a red Make America Great Again hat. And this is so interesting to me because when I was back in the US, I saw on my comments a lot of people saying, discouraging Filipino nurses from coming to the United States. Don't go there. Trump is the president. Don't, United States is racist. Don't go there, right? And so I'm looking at these comments and I'm like, oh my goodness. These people who are not nurses even are discouraging nurses from coming to the US and living out their dreams. And I thought, and look how they're using fear to do it, right? And so I know that there will be some people who will be caught up in, oh, I don't know if I should go to the US, is racist there, Trump is president, all these things. Listen to me. Whether Trump is president or not, nurses are needed. Nurses are welcomed, right? The need for healthcare rises above politics. You do not see nurses being deported. I'm trying to tell you this. Do not allow people's fear, their own fear, distract you from your dreams. If you have a dream to go to a place, get there. because your blessing is based off of your obedience. Okay. And, even here, coming here to the Philippines is not an easy thing for me to do. Not an easy thing for me to do, especially when I know that there's this discourse about United States and politics and things like that. And people say, well, you're coming here to take the nurses from the Philippines, and we need nurses here in the Philippines. And that is very true. I don't deny that you need nurses in the Philippines. But what I do believe in is professional development. And I do believe that an individual should have the opportunity to grow despite what other people are saying. And so the nurses in the Philippines can come to the US. I don't expect you to live in the US forever. I expect you to go to the US or Australia or Dubai or wherever you feel you want to be, learn from it, grow, and then improve your community, improve those around you, right? But living in fear of a location or living in fear of what people might think is never the way to go. Okay. So I wanted to say Monday motivation is do what is right and keep going. Do what is right and keep going. The memory verse is this. Peter began to speak. This is Acts 10:34 and 35. Peter began to speak. Now I truly understand that God doesn't show favoritism, but in every nation. Check this out. I love this. In every nation, the person who fears him and does what is right is acceptable to him. Oh. And so what I read here is that no matter what country you're in, you could be in the United States, you could be in Philippines, you could be in Nigeria, you could be in Canada, right? The blessing is not based on your location. It's based on your relationship and your willingness to serve a living God, right? God has purposed something for you to be doing. And if you find yourself doing it, no matter where you go, you will be blessed. No matter where you go, doors will open. And some of the first things that God will tell a person to do is get up and go, right? Abram, get up and get out of your father's house. I love when Mark talks about that. It's like you cannot flourish here. You need to go to a land I will show you. And if you can do that, then I can provide for you along the way because you're doing what you're supposed to be doing, right? If you can't see past your current situation, you won't be able to get up out of it, right? And so I feel like God is saying, I don't have, or Peter is saying here, he realizes God doesn't have favorites between, Jews and Gentiles. He is looking for the one who is willing to serve, who's willing to act out of love. And fear and love cannot dwell together. You're either walking in love and you see God's love in everything, good and bad, you see his mercies, or you're walking in fear and you're too afraid to step out on faith. God help you in that situation, right? Because you are so much more. You have so much more. It doesn't surprise you the things that you've already done. Doesn't it surprise you how far you've already gotten? And to have the realization that there's more for me to do. Like you're here because there's more for you to do. It's not just to be here studying with me. There's something else you're supposed to be doing. And that's what I realized, like even about myself, even though I love this is what I love to do. This is not all I am called to do. Right? I'm doing things that nobody has ever heard of, like ever. And it's just because my obedience is leading me to the next thing. And so I want you to know that, keep showing up, because in nursing, certainly you have to be willing to do what is right. Your documentation, when you write something down, it has to be what you actually did. You actually had to have given that medication and not just wrote down that you gave it. That's what I'm just going to say. I'm going to leave that there. The integrity has to be there. You have to be willing to do what is right, even when you don't feel like it. even when you don't feel like it. So my sisters, my brothers, let us journey on stepping out on faith. Yeah, stepping out on faith. Okay. All right. Obedience leads to the next level. Absolutely. So I just wanted to stop by this night. It is very late. I am very tired, but it is part of the adventure. So you guys are on the adventure with me. We will be exploring the Philippines this month, a beautiful island. I got a message from somebody that said, when I get out of nursing school, I'm going to the Philippines. And I'm like, that's so cool. That's so cool because it is a beautiful place. The beaches are amazing, but more importantly, the people in the heart. Can't ask for a better place. So I'm here to help you pass NCLEX. I hope to see you at one of my classes. If you have not signed up for it, please do. And also for those of you who are in the V2, get into it, keep studying. You can, yes, you will, and you must pass NCLEX. Bye-bye.